Welcome to Chamber Exchange, a TV show. My name is Tim Murray, President and CEO of the Worcester Regional Chamber of Commerce, and Chamber Exchange, a TV show, is an opportunity for us to bring on some of our chamber member businesses and organizations or individuals in the community who are involved in economic development and job growth for Central Massachusetts. This show happens because of our sponsors, St. Vincent Hospital and Bank Hometown, and our first couple segments are going to be a little healthcare related here, but pleased to have with us in this first segment Joe Garcia, who's the franchise administrator for Game Day Men's Health, and Liz Granata, who's the physician assistant and clinic director for the Game Day Men's Health franchise here in Worcester. Welcome.
Thank you. Thank you for having us.
Well, Joe, you've been an entrepreneur. You and your wife have successfully had a couple of business ventures.
Yes, sir.
Been active with the chamber, and also want to salute you as a Marine Corps veteran as well.
Thank you.
Thank you for that service. But what was the reason or rationale? What interested you about Game Day Men's Health that said, look, this is a franchise opportunity and a kind of a program and a concept that I'm interested in?
Yeah, no, for sure. First and foremost, I think for me, it was the ability to change lives on a massive level. There was a point in my time where I suffered from low testosterone, and excuse me, and I went from doctor to doctor, primarily primary care physicians who made the clinical decision that I was normal. I was on a low normal on the reference range, and my symptoms were normal, and I didn't feel normal. I felt down. I felt loss of energy, fatigue, and it wasn't until I found a hormonal health clinic that said, "Hey, you know what? We can optimize you to the higher levels, and you'll feel a lot better." At that point, I said, all right, I can do this. This speaks to me, and I can impact lives on a massive scale. And a lot of our friends now are in the age where our testosterone levels are dropping. And I said, you know what, we can change some massive lives here.
Got it. So, and I want to come back to that a little bit in a moment. But Liz, again, kind of how healthcare is delivered. And we were talking before we started, a physician's assistant, a graduate of the MCPHS program here in Worcester. But so, when a gentleman comes into Game Day Men's Health, what do they expect? What's the process, the screen?
So from start to finish, like the moment they walk in the door, we really just try to create a comfortable, welcoming environment for them to get started with just this conversation of understanding the component of their health that maybe they haven't really delved into. So they'll come in, get started with getting their blood drawn with our medical assistants taking care of that, and within about a 15 to 20 minute process, the blood gets spun down in our lab, and we're able to get the results back for their testosterone levels and other levels that apply to candidacy for testosterone replacement therapy. And in that time that the labs are being processed, I am able to welcome them into a consult, and we get to know just what they're dealing with, what they are going through, what's prompted them to think about coming to get their testosterone assessed, and what symptoms may be associated with that. And we go over medical history, the very important nature of all of other things that can affect starting another kind of therapy like testosterone replacement. And by the time our conversation and our consult is through, their levels are back, and we review those numbers, and they're able to have a better understanding of what the next steps of proceeding with something and deciding to go forward with a treatment plan look like.
Got it. So Joe, you talked about your situation, but there is a kind of a there used to be kind of stereotypes of how men approach. It's not good to acknowledge any type of issue or concern, and that really, I think, for the good is changing. And so, how do you kind of get that word out? Share people. Look, many of these things that men are dealing with are kind of natural aging things that have been going on forever. It's not anything unique or personal or about that individual. It's something almost we all deal with.
No, for sure. It's a great point. I think one of the biggest hurdles that we have to overcome is that negative stereotype when it comes to testosterone replacement therapy. Like, we're not aiming for super physiological ranges. These are therapeutic ranges at optimal levels, safe ranges. And so all we're doing is we're going to educate through our various forms of marketing in order to bring awareness to the importance of hormone replacement therapy. And just continue to change as many lives as possible.
Yeah, and Liz, we hear, and we're very blessed and lucky in Central Massachusetts to have some great healthcare facilities and providers, and Massachusetts is internationally renowned. And there's groundbreaking research and, this kind of concept of personalized medicine, right? Everyone's situations, genetics are a little bit different, the genders, but the sooner people are more proactive and kind of figuring out what's going on and anticipating things, better results.
Absolutely. Just being able to get a baseline and being able to come in to get an assessment, understanding symptoms associated with lower testosterone levels, and even getting that baseline testosterone number, people start to bridge the gap of understanding where those where their symptoms that they're suffering from could be related to testosterone, and how then to proceed. And it doesn't necessarily just have to do with testosterone replacement, but lifestyle factors too. And it kind of opens the door to really create a conversation about bettering health as a whole. Not just focusing on one piece.
And so that's probably what some of that screen about, but there's two things that, so Joe referenced some of the symptoms that he had felt where he wasn't, himself at that point in time. What are some of the other symptoms that might be common?
Some of the most common and noticeable ones men will start to feel is low energy, feeling really physically fatigued, feeling like physical and mental stamina are just declining throughout the course of the day. And then, of course, sexual symptoms are going to be experiencing lower sexual drive, changes in sexual libido, things of that nature. Also seeing changes in sleep habits, feeling just less energized and kind of uplifted in mood. And those are the very primary noticeable ones, but and they can even get into more specifics as well.
Yeah, and then maybe both can answer this. You said, in that screen there may be other lifestyle things that, beyond kind of the testosterone replacement therapy. Are there other things that, in the screenings or through the process that come up with that you can work with an individual on?
Yeah, absolutely. We also have weight loss treatments that we end up discussing a lot because, weight can have an impact on hormonal health. So a lot of times we end up having combined conversations about that. But we have weight loss treatment options that we can offer patients. We also have wellness treatment options like vitamin replacement and vitamin supplementation, and peptides as well, which is also a great resource for health and supplementation and wellness.
And so we have a couple minutes left. So we had a great ribbon cutting, a beautiful, the old visiting nursing administration building kind of in downtown. Great ribbon cutting. The facility looks great. Easy access parking off of 290. Joe, why don't you maybe talk about that?
Yeah, absolutely. So, ironically, I grew up right across the street from the V&A building in Plumby Village.
You and your bride?
Yes, we both of us, right?
Yeah,
My wife and I. It was awesome. So to kind of look back and see that we own a business that's going to change lives at a massive scale, and it's literally right across the street from where we grew up, is just huge. We've done so many things as of now. I think our patient census, even from our grand opening to now, or not the grand opening, the ribbon cutting to now has already grown to 178, and we were at 163, I think, a week ago.
Yeah.
So we're doing big things, and it's going to just continue to snowball, and that's what it's all about, transformation.
Right. And so the address, if people want to go online, how can they learn more?
Yep, so our address is 120 Thomas Street in Worcester, and they can go online to GameDayMen'sHealth.com.
And if someone goes on there, I assume there's a phone number, if maybe there's some questions or they might have, or they're able to talk with you, Liz, or someone else, or they really need to have them come in first?
Yeah, there's when they call in, they are contacted by one of our owners or one of the answering services, and they just go through some of those questions to gauge what exactly they're interested in, kind of getting that testosterone. They'll go through a survey of questions and anything that's necessary, filling out paperwork forms online to get started when they come in for their consult.
And cost, paying for that, insurance, I mean, how does that whole thing work?
That's such a great question, Tim. So we take a lot of pride in saying that we're the only men's health clinic, and I want to say in Massachusetts, that offers a free consultation, a free testosterone test. So there's no cost associated to the testosterone test, nor is there a cost associated with the consultations to sit down and meet with the clinician. And typically, you'll pay hundreds of thousands of dollars to sit in front of a clinician. Here at Game Day Men's Health, it's completely free.
Great. Well, thank you, Joe. You've been a great member of the Chamber in your various business ventures. There's no doubt this will be equally successful.
Thank you so much,
with the
Tim.
family. And Liz, thanks for joining us as well with the medical expertise.
Thank you for having me.
And you, our viewers, come back. We're going to talk a little bit about spine and more medical conversation when we come back.
These days, you've got your hands full in life. That's why we help you bank simply and securely with tools like Face ID and Touch ID. It's why we make it easy to make purchases on the go and get cash back while you're at it. Why we help you quickly deposit checks wherever you are. And it's why we lend a hand with sending and receiving money right from your phone. So even when you're on the move, you can manage your finances. Bank Hometown. Unlock your potential.